At the ASCO, the optimal trial was reported, presented. The optimal trial is a phase 3 study evaluating oral paclitaxel versus IV paclitaxel in HER2-negative metastatic breast cancer. So, paclitaxel is a cornerstone in the management of breast cancer, but it is solubilized by the CREM4. It is associated with the hypersensitivity reaction and the peripheral neuropathy, and requires infusion time. And 3 weekly versus a weekly show that weekly regimen is a higher efficacy, but because of weekly regimen, it requires more frequent hospital visits. So our hypothesis is that if the IV oral paclitaxel is alternative comparable to the IV paclitaxel, it can reduce not only a medical cost and the hospital visit, and it can overcome the disadvantage of IV paclitaxel. Before we conducted this trial, the oral paclitaxel has an advantage, free from the CREM4-EL, and also no need P glycoprotein. Phase 3 study was conducted in gastric cancer. It was approved in Korea and Japan. And also before we conducted phase 3 trial, phase 2 trial demonstrated that the progression-free survival is at 8.9 months, and the overall response is 50% in this population, and acceptable toxicities. Based on the previous results, this is the rationale to proceed into phase 3 study. This is a non-inferior design. So with the negative margin is the 1.33. So the primary endpoint is progression-free survival, oral paclitaxel versus IV paclitaxel. That hazard ratio is across 1. Upper limit of confidence interval did not exceed 1.33, which means it is so non-inferior, almost comparable. And also the overall survival data, response rate data, and toxicity profile almost comparable, although hematologic toxicity, neutropenia, thrombocytopenia, anemia is more common, and also GI toxicity, the diarrhea, nausea, vomiting is more common in oral form, but it is usually grade 1 and 2. It is manageable, but peripheral neuropathy, hypersensitivity reaction, infusion-related reaction is more common in the IV paclitaxel. So based on this comparable efficacy, the acceptable toxicity, this oral paclitaxel DHB-107 could be alternative to IV paclitaxel in the management of HER2-negative chemo-naive patient population. If it is the applicable in clinical setting, it can reduce the medical cost, administrative cost. It can reduce the hospital visit. It can overcome disadvantages of IV paclitaxel. So the oral paclitaxel, I mentioned that has that kind of advantage, but nowadays the paclitaxel is an important partner with the immune checkpoint inhibitor. So without the steroid, it is an advantage of this oral paclitaxel. And also the safety is an issue, so it can move to earlier, and also a good combination partner with the the immune checkpoint inhibitor. So it has more chance to expand further.